So, good afternoon. My name is Manuela Hargrave. I am a dietetic intern for the San Diego SDSU with dietetic program. And we're doing this project here with Skinny Jean, which is part of my rotation. And me and Dalia today, we're going to have a little conversation about gestational diabetes and maternal care after childbirth. So that's what we're going to talk a little bit today. You want to introduce yourself, Dalia?
Yes, hello, my name is Dalia Rodriguez. I'm also a dietetic intern. I will be talking about the second part about gestational diabetes and maternal care. Thank you.
All right. So what we're going to be talking today is to have a better idea how gestational diabetes is associated with a higher risk of developing type 2 diabetes on women after pregnancy. Okay, so that's what we're going to have this conversation. Okay, so first we're going to talk a little bit about what is this? What is gestational diabetes? So gestational diabetes, it's a very common disorder on pregnancy. And it's a type of diabetes that we can develop during pregnancy on women that obviously did not have this condition before, okay? And like any other type of diabetes, it's something that will affect our how our cells use the sugar in our body, okay? So usually when a woman does not have any high risk on her pregnancy, normally the doctor will ask to test for gestational diabetes around 24, 28 weeks, okay? And how this test done is we usually drink a glucose little solution, okay? That this test does not have to be first in fasting, okay? And then an hour later, we're gonna get our blood drawn. And then depending on the results, you either are good or you can be straight diagnosed with gestational diabetes, or the doctor might ask for a follow-up test, okay? And that follow-up test, it will be kind of the same thing. We're gonna have the glucose solution, which is gonna be a little more concentrated than the first one, but this one has to be done fasting. And then you're gonna have to drink one of those every hour. I'm sorry, you're gonna have to drink one of those, and then every hour you're gonna get a blood draw, okay? And then these three results is what gonna diagnose you with gestational diabetes or not, okay? And this one has to be fasting. So let's see. So I just want to talk to you a little bit about how we feel when we are diagnosed with gestational diabetes. I'm going to share a little bit about my experience. I am a mom of two, and I had gestational diabetes on both pregnancies. Obviously, first one is the most difficult one because even if we're doing everything we supposed to be doing, taking care of ourselves, gestational diabetes can still happen, okay? So, and we're gonna go over a little bit why is that, but we tend to not feel good with ourselves and we tend to feel guilty about it. So it's something very, very normal that can happen when we have that diagnosis, okay? So that's something else that we want to talk here because it's nothing usually that we actually did it, as you know, sometimes happens to different women, okay? So here, just put this quote from mom who had gestational diabetes. I couldn't believe it. I thought I had been doing everything right and was on track of the amount of weight I was gaining during the first few months of my pregnancy. So being diagnosed with gestational diabetes was shocking and overwhelming. Okay. So here in the United States, 2 to 10% of pregnancies are affected by gestational diabetes. Okay. And what causes gestational diabetes? So when we get pregnant, there's a lot of hormonal changes in our body, and also weight gain. Okay, that those facts help the body to not, I'm going to say, work really well. The insulin doesn't work really well, and we get a little, the glucose is built on our blood, not going to the cells, and we get insulin resistant. Okay, that means our body will need more and more and more insulin, and that's how we develop gestational diabetes. Okay, so in some women that happens. There are certain things that are risk factors when we develop gestational diabetes. Okay, so that's why we're having this talk here to try to avoid those things to happen, which is problems during delivery. Okay, there are big chances that that mom will have a large baby for the gestational age. Okay, when we say large babies, means when the baby is 9 pounds or more. Okay, and that, for example, can cause for the mom to have C-section, which the risks are higher than normal delivery. That baby can be born premature. That can cause the baby to have health issues, such as respiratory issues when the lungs are not well developed yet. The baby can be born with low blood sugar, okay? And the mom, when they have gestational diabetes, the chances that they can develop preeclampsia, which is a blood pressure problem during pregnancy, and also the risks of developing type 2 diabetes after, okay? Usually, gestational diabetes, it's something like other type of diabetes, does not have symptoms. So that's why it's very, very scary, because we can have it and not feel absolutely anything different until a certain point. So usually there's no symptoms, okay? So now we're going to talk a little bit about when you had gestational diabetes. Let's say the doctor diagnosed you with gestational diabetes. Did the doctor actually talk to you about what are the risks of having diabetes after you deliver? And so again, I'm going to share my personal experience here. On my first experience, my first pregnancy, I actually had a really bad experience. Nobody talked to me about on my postpartum what I needed to do, if I needed to get tested or still take care of myself or anything. And on the second one, I was very well assisted. So I got during pregnancy, I did everything I had to. After I also had a really good postpartum visit follow-up. So it can be tricky. Some doctors think that, okay, just because gestational diabetes goes away once the mom delivers, doesn't mean that we still need to be careful, take care of ourselves so we don't develop type 2 diabetes once our chances to develop that are higher now. Okay, so we're going to go over in a little bit about that experience. So what is prediabetes? Okay, so we're going to go over a little bit about that. So like I mentioned, gestational diabetes goes away and sometimes diabetes doesn't. Okay, so in order to know that, like I said, since there's no symptoms, we need to get tested. Okay, so a woman who had gestational diabetes needs to be tested at first on the between 6 to 12 weeks of postpartum. Okay, usually on the 6 weeks postpartum visit, and then after that, every year we need to be tested for the next 3 years. Okay, to make sure that we didn't develop or we're not developing, which means this stage being pre-diabetic. And what is that? It's a health condition where the sugar levels are higher than normal, okay, but they're not high enough yet to be diagnosed type 2 diabetes. But that it will definitely most likely lead for someone to develop type 2 diabetes if you are pre-diabetic, okay? So that's why it's very important for us to get tested and continue taking care of ourselves once you deliver the baby, okay? And Dalia is going to go over a little bit about that. But so I just want to share here some risk factors and symptoms for pre-diabetic diabetes, sorry. Usually there's also no symptoms, okay? And the risk factors associated is us being overweight, okay? Being 45 and older, having parents and siblings, so having family with type 2 diabetes, being physically active less than 3 times a week or not obviously being physically active, and having a history of gestational diabetes and giving birth to a big baby. Okay, so those risk factors put us in higher risk for being pre-diabetic and then after develop type 2 diabetes. Okay, so let me see here. So now Dalia is gonna talk a little bit and I'll be also sharing here with you guys about maternal care after childbirth.
Hello, everyone. I will be conducting the second part of the presentation. I will be covering some key points, the key points that are recommended after after delivery. The first one is continue medical attention. The second one is emotional stress. Third one is breastfeeding support, and the last one is healthy lifestyle. But before I go into the different key points, I wanted to ask a question. Why do you think it's important to attend your postpartum checkup after delivery? Some of the reasons, in my personal reason, when I was pregnant for my first child, to be honest, I didn't go to my postpartum checkup because I didn't think it was that important. But as you know, as I got pregnant for my second baby, and I was getting more educated about my pregnancies and everything, certain things came up, and the doctors were explaining to me that it's really important to continue your postpartum checkups. Some of the reasons why it's because it's recommended to have continuous medical attention, and some of the reasons is because you need to follow up with your OBs and also with your primary care. And with these visits address certain health concerns, the healing process after the delivery, and it helps also to explain or cover any possible health complications or down the line that you may have, and also makes that transition from your OB to your primary care easier. If you want to change to the other, so I did cover those. The continue. So it's like I said, it's really important to continue going to those postpartum checkups. They might not be one checkup. You probably have 2 or 3, depending on your OB physician, but it is very recommended to attend those visits just to follow up and just cover all your basics. And any questions regarding that? And so my next question would be, what are your thoughts on how gestational diabetes affects women emotionally? I personally didn't have gestational diabetes during my 2 pregnancies, but as as Manuela's experience, she explained herself that it's not really your personal, it's not your fault. It's just your body has not reacting accordingly during that whole 9-month period. But I just wanted to say that being pregnant in general is just stressful. So and just adding a condition or any complications can be overwhelming.
Yeah,
So
Dalia, I just want to, bring something up. Also, it's very important to know that because we tend to feel very worried about the baby, guilty that we're having that and feeling bad that, we're going to do something to our baby's health. So that's why taking, it's very important that we understand how everything is to treat and make sure that we're doing the right things so we can have a good outcome, because it's very, very scary.
yes, exactly. Like Manuela said, I mean, don't think that your baby will be well taken care of as long as you go like I said, to your follow-ups. Now, on the next slide, I did put some emotional stress. These are just little tips that you could do. If you feel kind of overwhelmed, sit or lie down or put your feet or, talk to your friends or families or partners regarding to whatever concern or stress that you may be feeling at that moment, just due to the diagnosis of having gestational diabetes or whatever complications that are added to your pregnancy. And I put the last one, lower your expectations of yourself. So I personally connect a lot to the last one simply because when I had my children, I wanted to be superwoman. I wanted to do it all. I wanted the career, I wanted to go to school, I wanted to be mom, I wanted to be wife, I wanted to do everything. But unfortunately, we have to be realistic about it, and we can't. We can't do it all. So allowing yourself to have a messy house or not do laundry for 2 weeks is perfectly fine, because that's exactly what I did. When I had my second daughter, I didn't do laundry for 2 weeks. And there was some times that I went probably like 2, 3 weeks that I wasn't cooking. So my husband was doing most of the housework and, taking care of everything else for me. So it's okay to have those lower expectations of yourself. It doesn't hurt, because you do need to take care of yourself and the newborn. And I also wanted to share a study, and how they conducted the study with 126 pregnant women that were diagnosed with gestational diabetes. And usually what happened in this study is that those 126 women, they found that being optimistic and self-confident had lowered their A1C levels. Their A1C level is a test that measures the amount of glucose that's attached to your red blood cells. So usually that's when you start detecting if you're pre-diabetic or you have gestational diabetics, they'll tell you your levels. But with this study, that's what they were trying to focus on, having a positive attitude or being optimistic, as opposed to the other part of the research. They found that women who were feeling like desperate or they were submission, their A1C levels were much lower. They were actually, sorry, they were higher. So that meant that they were more prone to developing gestational diabetes, or even prone to get diabetes down the line. Um, so just remember, try to, look up, try to find ways to de-stress yourself when if you are gestational. Do you have gestational diabetes? So my other question to you guys would be, what do you think about breastfeeding support groups? I know this is more of an individualized choice. As a WIC employee, our concern is we try to support you as much as we can with breastfeeding. But like I said, it is an individualized choice. To be honest, I tried to breastfeed my first daughter for 3 months. My second daughter, I did go a little longer. I went up to 6 months. But breastfeeding, it can become complicated if you have, depending on your family dynamics. It's not something that, it's an easy thing to do. In my personal experience, it wasn't very easy, but it just depends on how you look at things and how whatever you think it's more beneficial for you and your family in that perspective.
And sorry, Dalia, I just want to, focus
No,
a
go
little bit
ahead.
on something. The reason that we were talking a little bit about that, it's because there's a lot of studies that shows that moms who do breastfeed, it does help, at postpartum for us to have lower blood sugar. And the longer we breastfeed, decreases a little bit the risk of us developing type 2 diabetes later in life if you had gestational diabetes. So that's the reason that we're talking a little bit about breastfeeding.
Yes. Like Manuela said, it does help with lowering your risk. And if by any chance if you are diabetic, it also helps maintain your sugar levels while you're breastfeeding as well. On the next slide, I did provide some breastfeeding support. It's like a little, I did read an article. It was from the United Nations International Children's Emergency Fund, or the UNICEF. And actually what this article is doing is trying to make a call to all governments. I guess it's more like around the world thing. And what this article is trying to do is trying to promote and protect for women who have access to skilled breastfeeding counseling. And also, in addition to that, they want to make sure that mothers are getting, the support that they need and providing the information that they're getting their babies well nourished. Also, have these women overcome any types of barriers regarding breastfeeding. And also, one of the things that I really liked was that they're trying to incorporate that as, a health, a routine, a nutrition and a health service all together. So I think that would be a great thing for women, because I personally don't like to go to my 1 year checkups. But if we have that as part of our healthy routine, I think that would be great as well. Um, do you have any comments, Manuela, regarding to that about breastfeeding supports?
Sorry. No, just, we have resources. There's a lot of resources in the community. If you are looking for support, okay, there's groups, there's lactation consultants. We do have to share also the resources if anyone need that. So you can just request that, okay? And
in our next slide, like she said, I did put some few resources. WIC is a great resource. Sharp Healthcare Lactation Services, La Leche League San Diego County, and Palomar Health. Like I said, these are just a few resources that I just put here in the slides. But at the end of our presentation, there is a resource, and it'll be attached where you're gonna have much more information in regards to that. So now I want to go into, what do you guys think about a healthy lifestyle? To me, a healthy lifestyle could be anything. Something that you do a change that it's going to change your habits into a positive way. In my situation, I'm currently lowering the intake of sodium. Somebody could be, they transition from, to vegan or vegetarian. Whatever lifestyle you want to do, that's great. But according to the gynecologist, our next slide. According to gynecologists, they encourage physical activity as an essential role. and for post and pre-pregnancy. But do keep in mind, if you do you like to do exercise while you're pregnant, make sure that you do consult your doctor in regarding your physical activity. Just because of your pregnancy, or it could probably cause any. We try to avoid having any issues during your pregnancy. Also, with exercise, it helps you reduce your the risk of getting gestational diabetes, type 2 diabetes, preeclampsia, even cesarean births. And also, by having by doing exercise and having a healthy, rich diet with whole grains, fruits, and vegetables, and eating your lean meats like chicken, turkey, or trying to get lean beef meat. In other words, not that really greasy one. Also, I did put some examples of food that does not raise your glucose. Like I said, there was chicken, lamb, turkey, seafood. It could also include eggs, nuts, seeds, or cottage cheese. Non-starchy vegetables. Do you guys know what non-starchy vegetables? Anybody?
Like the green vegetables.
Yeah, green vegetables. So usually these vegetables don't have a lot of high contents of carbohydrates. I did put some examples like asparagus, broccoli, carrots, green beans, and kale. Now there are some that are starchy vegetables. Anybody have an example of starchy vegetables?
Potatoes.
There we go. Potatoes is the famous one. Also corn or sweet potatoes. So those are very starchy vegetables. I mean, if you want to consume them, just be aware you want to consume them in small amounts, not in very large amounts. The ones that are really recommended are your non-starchy vegetables. Okay. And I do have a recipe. The recipe is for burritos, spaghetti, squash boats. This is a plant-based, so it is preferable to be consumed once it's prepared because it is veggie and it kind of turns soggy as if you refrigerate it. And it does have some protein in there as well. So it's preferable, like I said, once you make that process, the meal, just eat it right away because it does take soggy afterwards. And
We actually have another one here.
Oh, we do have the other one. Okay, so the other one is tortilla soup. So that one, I think that one you could still refrigerate it for 1 or 2 days because it is a soup base as opposed to the first one. And then I think we have the last one too. No, that's it. Okay, so this one, protein based as well. You have your avocados and your little tortilla chips. You do have your little carbs with the tortilla chips, but those are very small amounts of carbohydrates. But that is a little bit doable as well. And then our last slide is, I think it's the resources, right? So those are the resources that we were talking about. They will be putting them up if you require any additional for breastfeeding. Any questions? Thank you.
I'm just gonna summarize a little bit. I think everything that we talk. I think one thing that is very important once we are on the postpartum period is to monitor our risks. We have the chance to lower our risks, and you're the only one who can do that. So, focusing on healthy eating habits, and that doesn't mean you're never going to eat anything that you like. Okay, it's just learning how to do that, learning how your body works. Also, focusing on physical activity, that is very, 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 very important for your mental health as well. Once you have a child, that will be very helpful for you. And as we mentioned, another fact that can lower the risk of developing type 2 diabetes after you have gestational diabetes is breastfeeding. So breastfeeding as long as possible will definitely help along with the healthy eating habits and the physical activity, okay? So that's our presentation today, our conversation, I should say. If any questions, just let us know.
Yes, thank you.
Hello, and thank you for your interest in the Diabetes Prevention Program. I'm Alyssa, the Program Coordinator for the Skinny Jean Project. Here at Skinny Jean, our goal is to provide you with support and community as you start on your health journey. I would like to have the opportunity to tell you more about the program and learn more about your needs. If you are curious to see if you qualify, please watch the following video.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.